3 years after it passed, the new Affordable Health Care Act finally began its first sign-up period. 2.8 million people visited the site on its first day.
LUTV's Brittany Velasco joins us with an in-depth report on what you need to know about signing up.
The Affordable Health Care Act, or is most known as Obamacare, generated a lot of visits on the first day and also a lot of glitches. The Washington Post reported that one California man waited 3.5 hours to register for the benefits. But what exactly is in the new policy, and why should not only Missourians, but Americans as a whole consider checking their rates and applying?
We currently have about 50 million uninsured Americans. That's 1 out of every 6.
Out of those 50 million uninsured Americans, 800,000 of them are Missourians, making it 1 out of every 7. Passed in March 2010, the Affordable Health Care Act was created to ensure every American would have health insurance. The first enrollment period for applying on the healthcare marketplace began on October 1st. Ryan Barker, the health policy expert for Missouri Foundation for Health, explained how Americans can sign up.
Marketplace is it's an online portal, so it's a website that you can go and visit. You have to create an account, and then you can shop and compare health insurance prices and plans and pick one out that works for you and your family. So to get to the marketplace, you go to healthcare.gov.
One of the main themes in the new Health Care Act is trying to prevent disease instead of waiting until someone is sick to get it treated. Before the new Health Care Act, older people were paying more than 8 times the amount younger people were paying, but the new health care has lowered that to only 3 times the amount. Another part of the policy is to improve the quality of health care that everyone can receive.
One of the new rules for insurance and the way insurance works is they cannot exclude you or charge you more for pre-existing health conditions.
For those who decide to not get insured, could receive a penalty fine. This fine will not be given to individuals who make less than $15,000 a year if it is stated in your religious doctrine to not believe in having health insurance, or if you live in a state without Medicaid expansion, Missouri being one of those states. Another concern of the Affordable Health Care Act was the role of insurance agents. After it passed, several thousand insurance agents left the market altogether nationwide.
They said there's no place for us here. People are going to go on a website, they're going to sign up for insurance like they go to Amazon, and buy a TV.
Andrew Hale, an independent insurance agent and owner of Hale Insurance Agents and Consultants, still believes there is a major role for agents.
The average consumer may sit here and this thing may refresh 50 times, but if you pick up the phone and call an agent or call a broker and say, hey, can you find my rates for me? We have access that the normal public doesn't have.
The Affordable Health Care Act has been receiving negative feedback, and Barker and his team did some research as to why.
What we found was people just don't know. They don't have the information. Most of them had never heard of the word marketplace. So a lot of people hear Obamacare and they don't like it, but they don't really know much about it.
The main goal of the Health Care Act is to make sure every American is insured, whether that is through the government or an insurance agency.
If you take a plan with a $10,000 deductible, that's still better than not having insurance. So, don't go around without it.
The first enrollment period is from October 1st until March 31st, but if you sign up by December 15th, your health insurance will start with the new year. And if you have pre-existing health insurance, it is still recommended to check your rates online to find the best affordable option for you. Log on to healthcare.gov and click the Apply button to make an account. For LUTV News, I'm Brittany Velasco.